Good morning, everybody. I want to talk to you a little bit today about Liverpool Community Health and our experiences with Telehealth. Apologies if you've seen this slide before, but I liken our journey to be a bit like a board game. Sometimes we win and then we lose really bad and then we climb back up again. Our journey's been difficult because we really didn't know about the technology that we were working with. We didn't know how it interacted with the patients, and we didn't know how it interacted with the nursing staff or with the GPs. So when we first started in 2011 with a proof of concept, we actually chose the patients ourselves, the patients we thought would benefit from technology. And actually we caused lots of anxiety, lots of problems. And what that actually did was, because we chose the wrong model, we chose the wrong patients, we created lots of alarms and anxiety in the system. The GPs lost all faith in us, really. So when we came along with the My project, this ambitious project to get to scale, we really struggled. So for the first year or so, we were lucky if we got 60 patients recruited through the GPs. So we had to strip it right back to basics and look at how we could do it. And so we started off with a full engagement with GPs. We looked at all the digital care plans that were there and whether they worked for the patients, whether they worked for primary care, and whether they worked for us. Once we'd done all that and put the basics in, the basic sort of clinical nursing care into the digital platform, we actually started to grow. With growth came a loss of trust in the system. So we grew very quickly. And then lo and behold, we couldn't actually cope with the growth. We suddenly had 1,600 patients going through telehealth. We couldn't cope with it because actually we still hadn't worked out what the technology did. So we had lots of alarms. So we had to then start looking at how we were managing those. So we actually reviewed with our partners all the care plans that were there on the technical system, which was really painful, I have to say. It wasn't my best day. But again, once we invested the time into the technology and married it up with the clinical side, we actually started to get success with it as well. And so we were able to move on and actually grow significantly, and you can start to see from here. So in the early days, the first couple of years of we struggled because we didn't know our business. Once we started in 2014-15 looking at the practicalities of the technology and what it meant for our patients and what it meant for the clinicians who were working at it, that's when we started to get the success. Today on Telehealth, we've got approximately 950 patients being monitored at any one time. We're up to 4,900 patients who've been through the system since about 2014. And we're sustainable now. You know, we've got them. We can sustain that same amount of between 40 and 50 new patients per week going onto the system. So we've gone from a beginning where patients reported that they felt more anxious, that they felt, you know, they didn't feel comfortable with the system, and the GPs didn't, to now where we've got to the point where 86% of the patients feel more confident to manage their own health. Say about the same amount feel more in control of their long-term condition. And what a recent study has shown is it can reduce A&E presentations by about 30%. And primary care activity by about 32%. And that's comparable with what our patients tell us as well in their patient-reported outcomes. What it's meant for us as a nursing team is that we are now able to share information at the right time. So we're able to look at the technical system, we're able to now look at the primary healthcare system and talk to our patients, triangulate that information and guide them and support them to manage their care. We're able to enhance some of the care that our colleagues provide as well, because we've got this wealth of information about patients on the system that we can actually guide them into what the next stage is for treatment. So we regularly are picking up newly diagnosed potential for hypertension, AF, and so we're able to refer into the GPs and actually suggest that they may benefit from some more investigation. That admission avoidance is reducing the secondary care costs, reduction in all those follow-up appointments, reduction in hospital admissions, but most importantly, it's enabling our patients to self-manage now. So we've gone through this whole process of starting off, getting to scale, saying how wonderful we are, but I always had this niggling doubt in my mind about the quality side of things. How did you benchmark something where it didn't exist elsewhere? And then I came across TSA, and we decided to put ourselves forward for assessment under the quality standards framework. What that enabled us to do was actually get somebody from the market to actually look at how we're providing care to our patients, whether it was safe, whether it was effective, whether we had the right business continuity, and whether we had the right information governance in. I think the assessment actually came out quite well, yeah. But it actually taught us as well that we've got things to learn. What has also enabled us to do is actually now suggest to our commissioners exactly what really our KPIs should be. So from that point of view, so what's the future for us? Lots of new ideas coming through, lots of work going on around early supported hospital discharge, supporting our community care teams and our community matrons. We're starting to help them now, release some capacity for them to care for those patients most in need, so we will do some shared care with them. We're also looking at sort of supporting multi-user settings now. And Telehealth Plus, which is a new initiative for us, which is embracing the concept of every contact counts. So basically, now when we're actually going out to assess for telehealth for those hard to reach groups, we're actually looking at a whole range of public health and primary care needs that they've got as well, whether it goes from bowel screening to flu campaigns and just targeting them in the right direction. So I suppose for us now, what is the future held? Well, it's back to basics. So it's back on that journey again. So we're just starting to work now with the community respiratory team. They've decided now that they would like all their patients to go onto telehealth from the day that they arrive on the caseload. So now it's about working with them to make sure that the care plans fit, that the system works for the patients as well as the service, and that hopefully then we'll get the right outcomes. Thank you very much for your time. Really appreciate it.